Welcome to this video on smallpox, or variola, the eradicated disease, focusing on community health nursing aspects. This content is targeted for various nursing examinations. As we begin, remember that making an extraordinary difference requires that little extra effort. Stay dedicated to your goals. Smallpox is scientifically known as variola. It holds the unique status of being the first and only disease completely eradicated from the world through human intervention. The agent is the variola virus. It is a large, brick-shaped, double-stranded DNA virus belonging to the Poxviridae family. It can remain highly resistant in dry scabs. There were two main clinical forms. Variola major was severe, with a case fatality rate of 20 to 40%. Variola minor, or alastrum, was milder, with a fatality rate of less than 1%. Examining the epidemiological triad, the agent is variola virus. Importantly, humans were the only reservoir, with no animal reservoir or carriers, which was crucial for eradication. Overcrowding favored transmission. Transmission occurred primarily through droplet infection from face-to-face contact, airborne droplet nuclei, and fomites like contaminated clothing. Scabs were infectious. The incubation period ranged from 7 to 17 days, with an average of 12 days until the onset of illness. The patient was not infectious during this period. Communicability began from the development of the first lesion in the mouth or throat and lasted until the last scab fell off, usually spanning 3 to 4 weeks. Clinical stages included the prodromal stage with sudden high fever, backache, and headache. This was followed by the eruptive stage, where the characteristic rash appeared, typically on the 3rd or 4th day of fever. Let's review some basics. The causative agent is the variola virus. There is no animal reservoir. Only humans are affected. The average incubation period is 12 days, and variola major is the most severe form. The rash exhibited a centrifugal distribution, meaning it was concentrated on the face and extremities, such as arms and legs. The trunk had a sparse rash, and the armpit area was usually free of lesions. The evolution of the rash was slow, following the sequence: macule, papule, vesicle, pustule, and scab. Each stage lasted about 2 to 3 days, with pustulation occurring around the 2nd week. The lesions were deep-seated, feeling like pellets under the skin, often described as, quote, shoddy. They featured central depression, called umbilication. They left deep, permanent pockmarks, leading to disfigurement. Monomorphism is a key characteristic. All lesions in a specific area are at the same stage of development. This is a critical difference when compared to chickenpox. The rash always affected the palms and soles, distinguishing it from chickenpox, which usually spares these areas. The rash also affected mucous membranes, known as enanthem. Fever appeared 3 to 4 days before the rash. The fever typically subsided when the rash appeared, but would rise again, a secondary fever, when the pustules formed. This slide provides a detailed comparison between smallpox and chickenpox across various parameters like fever, distribution, and lesion characteristics. The correct answer to the question about rash characteristics is B, centrifugal and monomorphic. Complications included severe scarring, ocular issues like corneal ulcers leading to blindness, and respiratory problems such as pneumonia. Neurological and bone complications also occurred. Laboratory diagnoses involved examining specimens like vesicle fluid and scabs. Techniques included electron microscopy for brick-shaped virions and identifying Guarnieri bodies, which are inclusion bodies. Management historically involved strict isolation until the last scab separated, supportive care, and antibiotics for secondary infections. Immediate notification to WHO was also mandated. The smallpox vaccine, invented by Edward Jenner in 1796, was the first vaccine ever. It was a live, attenuated vaccine using the vaccinia virus, a cowpox strain, often in a freeze-dried form. Vaccination was done using the bifurcated needle and the multiple puncture technique on the deltoid area. A successful vaccination, or take, resulted in a pustule leading to a scar. Reviewing vaccine basics, Edward Jenner is the father of vaccination. The bifurcated needle was used for the live vaccinia vaccine. Scar formation indicated a successful immunization. Several factors favored eradication: humans being the only reservoir, the absence of carriers, easily identifiable clinical features, a highly effective and stable vaccine, and lifelong immunity after infection. The core strategy was surveillance and containment. This involved active case searching and, quote, ring vaccination, where contacts and people in the immediate vicinity of a case were vaccinated, creating a ring of immunity. In India, the last indigenous case occurred on May 17, 1975. India was officially declared free of smallpox in April 1977. Globally, the last natural case was on October 26, 1977, in Somalia. Global eradication was formally declared on May 8, 1980. The correct answer to the global eradication date is C, May 8, 1980. The location of the last natural case in the world was D, Somalia. The key strategy used for smallpox eradication was B, ring vaccination. India was declared smallpox-free in B, April 1977. Despite eradication, concerns exist about the virus being used as a bioterrorism weapon, classified as a Category A agent. Preparedness involves stockpiling vaccines, like ACAM 2000. Mpox, or monkeypox, is a currently relevant related orthopox virus. The smallpox vaccine offers about 85% cross-protection. Mpox is milder than smallpox and features prominent swollen lymph nodes. In summary, smallpox is caused by variola virus and transmitted via droplets. The rash is centrifugal, deep-seated, and monomorphic, involving the palms and soles, often resulting in permanent scarring. This chart summarizes important historical dates related to smallpox eradication, including the final case and the official Declaration of Freedom, both in India and globally. Final rapid-fire questions. Smallpox was the first eradicated disease. Scabs are infectious. Isolation lasted until the last scab fell off, and the rash was usually absent on the axilla. Thank you for watching this video. Believe you can achieve your goals and keep working hard for your dream job. Thank you for watching this video. Believe you can achieve your goals and keep working hard for your dream job. All the best for your upcoming NORCET and RRB exams.